First, let's understand the uterus. The uterus is a small, pear-shaped organ in the lower abdomen. Its main job is to support a baby during pregnancy. But even when pregnancy is not happening, the uterus is still very active every month. After your last period ends, the body immediately starts preparing for the next cycle. Inside the uterus, a soft inner layer called the lining, or endometrium, begins to grow. This lining becomes thicker, softer, and full of blood vessels. Think of it like the body preparing a comfortable home for a possible baby. Around the middle of the cycle, ovulation happens. This is when an egg is released from the ovary. The egg travels toward the uterus, and the body waits to see if it will be fertilized. If the egg is not fertilized, the body realizes pregnancy will not happen this month. So hormone levels, especially progesterone and estrogen, start to drop. When these hormones fall, the uterus no longer needs that thick lining. The blood supply to the lining decreases, and the tissue begins to break down. This breakdown process is what leads to your period. But before the bleeding actually starts, many changes are already happening inside your body. The uterus may begin to contract slightly. These contractions help push the lining out later, but they can also cause cramps or a heavy feeling in the lower abdomen. You might also notice bloating. This happens because hormones can cause the body to hold extra water and slow digestion. Breast tenderness is another common sign. Hormone changes make breast tissue swell and become sensitive. Emotionally, some people feel mood swings, sadness, or anxiety. This is known as PMS, premenstrual syndrome, and it happens because hormones affect brain chemicals too. You may also feel more tired than usual. Another common sign before a period is vaginal discharge. It may become thicker, creamier, or white. This is normal and shows your body is moving toward menstruation. As the start of the period gets closer, the cervix, which is the opening of the uterus, softens slightly to allow the lining to pass out of the body. Finally, the lining sheds and leaves the uterus as menstrual blood. This marks the start of a new cycle. It's important to remember that every body is different. Some people have strong symptoms, while others feel almost nothing at all. Most of these changes are completely normal and show that the reproductive system is working as it should. However, very severe pain, extremely heavy bleeding, or symptoms that stop you from daily activities should be checked by a healthcare professional. Taking care of your body before your period can help reduce discomfort. Drinking water, eating balanced meals, gentle exercise, rest, and warmth on the lower abdomen can make a big difference. Your menstrual cycle is not something to be ashamed of. It's a natural and powerful sign of health.